Welcome, doctors, but plays a crucial role in the smooth running of your practice, medical coding. Specifically, pediatric medical coding. It's a unique area, full of complexities, but it's absolutely essential to ensuring accurate billing, compliance, and, most importantly, better patient care for your youngest patients. We all know that coding in general can be a minefield. But when it comes to pediatrics, things get even trickier. Because pediatric care isn't just a smaller version of adult care. It's a completely different ballgame. Let me explain. First, there's the matter of age-specific codes. Pediatric diagnoses are often tied directly to developmental stages. And let's not forget congenital anomalies or developmental milestones, they each have their own set of specific codes. Even the patient's age can influence reimbursement. Miss that detail, and suddenly your claims could be denied. That's why precision is key. Then, there's vaccine administration. Vaccines are a cornerstone of pediatric care, but coding them accurately? It's not as straightforward as it might seem. Each vaccine has its own CAPTAIN and HCPCS codes, and you'll often need to include additional information like the route of administration or even the lot number. Oh, and don't forget those age modifiers. They're a must to ensure compliance. These are so common in pediatrics, yet coding them can get surprisingly complicated. For instance, if you're handling both a well-child checkup and addressing a medical concern in the same visit, you'll likely need to use a 25 modifier to indicate additional services. A small oversight here can lead to major claim rejections. So, how do coders keep up with all this complexity? It's no small feat. Staying current with constantly evolving coding guidelines is essential. Take ICD-10 updates, for example. Just recently, new codes were introduced for mental health screenings during pediatric visits, a growing area of focus in today's healthcare environment. Coders need to stay on top of these changes or risk falling behind. Pediatric-specific software tools, like vaccine calculators or age-based coding prompts, can help coders reduce errors and work more efficiently. But let's be honest, tools are only as good as the person using them. That's why certified coders, especially those with a pediatric focus, are such a valuable asset. Outsourcing. Managing pediatric coding in-house is time-consuming and requires constant vigilance to stay compliant. That's why many healthcare providers are turning to outsourcing as a practical solution. When you outsource to experts like the team at Staffingly, Inc., you get coders who are specifically trained in pediatric coding. They understand the nuances of age-specific codes, vaccine documentation, and even those tricky well-child visit modifiers. With their help, your claims are not only accurate but fully compliant with payer guidelines. Outsourcing can reduce your staffing costs by up to 70%. That's money you can reinvest in patient care, technology upgrades, or even expanding your practice. By outsourcing your coding, you also free up valuable time. Imagine not having to micromanage coding tasks or chase after denied claims. Instead, you can focus on what really matters, providing exceptional care to your young patients. So, doctors, the bottom line is this: pediatric coding isn't just complicated, it's critical. Whether it's mastering vaccine schedules or navigating age-specific codes, trained experts are here to take the burden off your shoulders. And if you're considering outsourcing, companies like Staffingly, Inc. have the expertise to make sure your coding is accurate, compliant, and cost-effective. So, you can focus on doing what you do best, caring for your patients. Thanks for watching, and as always, thank you for everything you do for your patients.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.